Yeah. Which one is the first station and who's going first?
I was doing first.
Okay. And so you are the candidate, right?
No, so I was a role. Yeah, I was a candidate. Yeah.
And who's the role player?
I'm the role player.
Okay. So Zainab, yeah. Can you give
Yes.
the station?
Yes.
Just give me a second. So with regards to GHB, I could not find the exact station. What I found was it was someone who collapsed at a party.
Zainab, you are on mute. Zainab, I'm not sure if you are talking to us, but if you're talking to us, you are on mute. Well, go ahead, Iqbal, please.
Okay.
Zainab, you are on mute.
Zainab, please, are you listening? Zainab, you are on mute.
Post the first station, if that's okay. I could share it.
Yes, please.
Okay. Can you see it?
Yes, we can. Thank you.
Hello.
Hello, Zainab. Zainab, you were talking for like a minute or so, but you were on mute.
Oh,
Yeah, we were trying to, to alert you, but it seems the audio itself was not working. But anyway, thank you, Diamond, for sharing. This is the station, Prisoner with the History of Assault. This is a very common station. I had it in the exam in January. Yeah, so if you can read the task, Iqbal, or if you are already familiar with the task, then Dr.
I'm
Anne, you can
reading.
start.
I'll stop sharing now.
Just give me a second.
Okay.
Sorry, what does it say that then he has previously used various illicit substances while being in prison? Okay. Right, yep, that's fine.
Okay. Okay, so enter the station. Both of you ready? Please, whoever is doing, have the cameras on, please. Who's the role player?
I'm the role player.
Okay. Both of you ready?
Yes.
Okay, start.
Hi, Mr. Griffith. I'm Naya, one of the doctors from mental health team. I have been asked to speak with you because sorry, I confuse it. Is it? Do we need to explain it to the nurse? Or do I need? I need to.
Yes, I'm the nurse.
Oh, you are the nurse, right? Okay. Hi. My name is Naya. I'm one of the doctors in the team. How may I help you?
Doctor, actually, I'm here to discuss about one of our patient, Mr. Griffith.
Mm-hmm. Right, yeah. What do you want to discuss?
Actually, doctor, I don't know what is, I mean, I hope you know about him. Actually, I want to know more about him from you. Like, what is it causing Mr. Griffith's difficulty? Why is he behaving like this?
Okay, so I know from what I know, from my knowledge, he has recently been having he has recently been voicing hallucinations, and he is worried that people are going to harm him, and he thinks that he might impulsively act on his thoughts as well. And there are concerns that he might be using an illicit substance called GHB. Have you ever heard about GHB?
I mean, yeah, doctor, I know what GHB is. And I mean, do you think it could be because of GHB or something else?
So there have been like this these concerns that he has been using he has used illicit substances in the prison before as well. So what I'm thinking is it could be drug-induced psychosis. Do you know much about the drug-induced psychosis?
No, doctor, I'm not aware about that.
Right. So drug-induced psychosis is when, because of the illicit substance use, for example, like GHB or other drugs, for example, like amphetamines and methamphetamines, people can go on to develop psychotic symptoms. For example, they can hear voices when nobody is around. They can also have visual hallucinations as well. You know, there's an increased paranoia. And sometimes patients can act on their paranoia and can actually harm other people because they are perceiving them as because they perceive them as threats. So does it make sense?
Yeah, doctor, yeah, it makes sense. So what do you think? What is the risk in his case, Mr. Griffith's case?
Well,
Do
so
you think he can harm people?
in terms of risk, you know, there can be different kinds of risks, you know. So he can be under because of his paranoia, he might see people as threat, and like I said, because of because of his perceived threat, he can actually attack other people. So that's one kind of risk. But then, you know, he can be at risk from other people as well. You know, he can be at the risk of retaliation. So that's another thing, another risk to be aware of. And obviously, because of, for example, there's a risk of self-harm as well if he feels really distressed by his experiences, which is not making sense to him, and because he's feeling so threatened, it might be that he might try to harm himself as well. So that's another kind of risk we need to be aware of. Does this make-
Yeah, doctor. So what is your plan now? How will you manage him?
Supposed to explain the management options and explain the
Sorry, I can't hear you.
Doctor, what is your plan now? How will you manage him?
So we are going, so we will need to have we need to do a urine drug screen in first place if you haven't done it on the ward. We need to keep him in the hospital. So if he tries to leave, he needs to be assessed under the Mental Health Act. Well, in this case, he can't leave because he's already under the he's already, like, you know, he's in prison. So we need to keep him in the hospital. So I think that makes it easy because he will be under some kind of forensic act. So that's one thing. We also need to do his bloods, which includes full blood count, urea and electrolytes, his blood glucose, his HbA1c, as well as his lipids, So we will need these bloods. He will also need an ECG because we want to start him on antipsychotics. So in order to be started on antipsychotics, he needs to have an ECG before, because we want to know whether there are any abnormalities with the ECG before proceeding with the antipsychotics. Yeah, if he becomes agitated, then we can give him some PRN as required medications, for example, lorazepam.
Okay, doctor. And my main concern is, when can he return to the prison wing? I mean, since you
1
know we
minute.
have limited place.
Well, so obviously, we need to observe him over a short period of time. And and obviously we need to treat his symptoms first, and once we establish him on a medication and there is an improvement in his symptoms, then obviously we can think about the transfer back to the prison. But I don't think at this moment we should be transferring him back.
Yeah. Okay, doctor. So I mean, I still am confused, because I also heard that he has seen one of his inmate, some fights were there, and after that I think all these have started. So what do you think? Is it because of that incident, or it
Time
could be
up.
because of substances?
Time up.
Thanks.
Okay. Okay, so let's go with the feedback. Okay. Now,
Sorry, I hadn't read this station at all, and I didn't know anything. I think I misread. I mistakenly read it, and I read another station and prepared that one. So this was completely spontaneous for me.
no, that's fine. You did pretty well. There's just few things I want to tell you. See, whenever you are doing a station, try
Yeah.
to maintain eye contact. Okay, like in your body language, you should be looking at the ceiling and answering the question. So try to maintain proper eye contact. Be very confident in what you are saying.
Yeah.
Other thing is, I mean, this is for everyone. If you are not sure about a station, it's best to post in the group prior that which station is this. I'm not sure. Is it this station? Just to because otherwise, there's no point in your practice.
Yeah.
Now, during your station, there were lots of jargon used. Okay, like voicing hallucinations, talking about HbA1c. Okay, now see,
Yeah.
don't just memorize an answer and go and give and cast. That's one of the reasons why people fail. Whenever you
Yeah.
are talking something, and if you don't know anything, don't bring that topic. Like, for example, he will be detained under some forensic act. This is
Yeah.
not expected from a doctor.
Yeah.
You know the act, you shouldn't be saying it. Okay.
Yeah. Yeah.
First of all, you should read the station very well. The person is in prison for the
Yeah.
last 3 months.
Yeah. He
Okay.
will be.
The
So,
behavior changes have been noticed only since last 2 days, and he's been brought to the hospital wing of the prison. He's not in hospital.
all right. Okay. Yeah.
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 So see, these things, if you will go and say in the exam, they'll be like, immediately actor will hold on to that and he'll say, Doctor, he's not in hospital.
Yeah.
So
Yeah.
because we're talking about detention under Mental Health Act and all sorts of things, but there's a
Mhm.
whole separate system when a person becomes psychotic in prison and the needs hospital admission.
Yeah.
Entirely different rule. If you don't know, you don't know. That's it. You're not supposed to know if you are even if you are a UK graduate and you've not been trained in forensic in your core training, you won't know. So you shouldn't. You if you don't know, you don't know. That's it. Just comment on what the person is asking. So if they are asking, Doctor, I don't know anything about the patient. Can you tell me what's going on? So ideally, you should start with a brief background of what you have
Mhm.
been given. That he's a 32-year-old person. He was sentenced for assault, common assault, or whatever is given to you in your station. He's
Mhm.
been in prison for last 3 months. Recently, he
Mhm.
witnessed another prisoner who was being violent. After that, he has been reporting that he can hear voices. Don't say hallucination. He feels
Mhm.
that someone is able to influence him. He's having these thoughts. He's voiced the thoughts that he wants to harm others, although he's not acted on these.
Mhm.
He's been brought to us for assessment 2 days back. And
Okay.
many times the nurse will say that, Doctor, they are using GHB. So again, you should question, why do you think they're using GHB? How do you know that? Most of the
Mhm.
time, prisons have lots of drug use. So they might say, doctor, it is there in the prison. All right. So if the person was brought to the prison 2 days back, was any
Mhm.
urine drug test done? Was any investigation done? What actually happened in the last 2 days? Many times they'll say, no, doctor, nothing. Or at times they can even throw it back to you. Like, doctor, I saw him yesterday. There was no behavior issue. He was not responding to any stimuli. That can also happen. Be
Okay.
prepared for anything. So because they are a person who's in prison, even in the health wing, they are not monitored 24 into 7. So they might just have one occasional visit by the prison mental health team who noticed him to be all right. It could be like that. And they can say, because I know one of the candidates is get this question that Dr. Nothing, I saw him absolutely fine. He was responding well. He was eating his food. So you have to be prepared for all sorts of those sorts of questions.
Mhm.
So, and then she asked you one question. Do you think it could be because of GHB? And
Mhm.
you said we are looking at drug-induced psychosis, but in your station, I could not get any proof that you actually went and assessed the person. Have you done your assessment? Have you done a mental state examination? It's not clear.
Mhm.
So first, you should say if you have done it. As far as I know, in
Mm.
this station, the doctor has not actually done this, assessment. But if it says that yes, you have already witnessed and you have assessed the prisoner, and then address the concern, is different. Most of the time, the doctor has not assessed. So you can say it can be. It could be one of the reasons
Mm.
that the person is presenting like this because of drug use. But we still need to assess him. Okay, we still
Mhm.
need to make our assessment. We still need to go and see how he's doing, and then you can offer them to come with you. You can say we can go and see him together.
Mm.
Okay, many
Yeah.
times they can ask you a question like, doctor, you're saying urine drug screen, but GHB normally doesn't come in the urine.
Mhm.
Again, you can say, well, that's a good question. At times GHB, I mean, most of the time GHB will not come in the urine drug screen. But then when we do the urine drug screen, we come to know if he's taken any other substance.
Yeah.
Most of the time the substances are mixed substances, so we can see if there are any other elements. Plus we don't have a proof that he's taken GHB, so anyway urine drug screen must be done.
Mm.
Now about the risk. Okay, so he's at risk because if we send him prematurely, he's having these psychotic thoughts, and he's having these thoughts of harming others. He's hearing voices, he feels people can influence him, so he can act on that.
Mm.
Others can retaliate. Yeah, that's fine. Also, this person is serving sentence for assault. So a
Mm.
prior history of any forensic history means the chances of it repeating in future is very high.
Mm.
Okay? The recidivism. So you can say that, because he's serving a custodial sentence for assault, we can't rule that out because, it is very likely to repeat in future.
Mm.
Okay? So don't just say any forensic act. If you don't know anything, just don't say. Okay?
Yeah,
Now
sorry.
about
The problem actually was because, like I said, I was kind of thrown back by it because I thought I had prepared the station well, but I had read something else, and then this came up on the screen, and I was trying to quickly read, but I hadn't completely read it as well. So I think, yeah, I think a lot of things which kind of contribute to the confusion. And then obviously I panicked. So
No, that's fine. But the thing is, see, not all stations in your exam will be known stations. So you should be prepared.
yeah, no, that's true.
Yeah. The
Yeah.
other thing about the investigation. Now, see, when you're talking about blood glucose, HbA1c, what is the relevance?
No, you're just looking at the long term, like, because we know the antipsychotics cause metabolic syndrome. So we need to know the baseline before we start someone so that in the long term, if something happens, we know whether it's happening because of the drug
Are you
or,
sure all antipsychotics cause metabolic syndrome?
sorry?
Are you sure all antipsychotics cause
No, not
metabolic?
all. No, not all, of course, no. But like, say for example, if you are starting him on olanzapine, then olanzapine is notorious for metabolic syndrome. So at least this is something that I was saying from my practice, because when we see patient and when we clerk them, we always do like HbA1c and blood glucose and cholesterol and those kind of things, so that we know, so that we know the baseline.
Well, I would not go for HbA1c, especially for somebody who's in prison.
Okay.
The other thing is we don't even know if he's psychotic. It's such a preliminary stage, just 3 days, 2 days behavior changes. It's too early to comment. And the
Mhm.
other thing is metabolic syndrome is not just because of antipsychotic. There's so many other things. You have a station on metabolic syndrome, isn't it?
Mhm.
So it's not only because of your medication. There are so many other causes like your diet, environmental factors, which contribute to metabolic syndrome.
Mhm.
So even if you don't get a baseline, doesn't mean you can't start antipsychotic. Yes, physical health examination is a must. ECG is a must.
Hmm.
Baseline blood test. That's it.
Okay.
Doesn't have to be that all the parameters need to be examined, especially for somebody who's in prison. The prison is a
Mhm.
different environment. He's not somebody who's a routine patient in the hospital.
Hmm.
So most important thing is like I said, have you seen the patient? Have you not seen the patient? If you've seen the patient, okay, fine. Then you should be giving your assessment. When I interviewed or when I reviewed him, this happened. If you've not seen, you should say, I will go and see him as soon as possible. You're welcome to
Mhm.
come along, which was not clear. Plus,
Mhm.
what will you do when you see him? You will do his mental state examination. You want to see him, for a couple of days. You want to also do the baseline blood test. You want to do physical examination. You would like to get a tracing of the heart. Don't say ECG. And
Mhm.
then, if he comes across as psychotic, we may have to start him on a low dose of some antipsychotic.
Hmm.
Plus, watch him for a few days. And if he's not considered a risk to himself or others, only then we can send him back to the prison.
Mhm.
Yeah, that should be the whole thing. Because, see, if you are yourself not clear what you are talking, the actor will be
Mhm.
more confused, isn't it?
Yeah.
Okay.
I have a quick question.
Yeah.
So in this case, for example, if even if we are talking to a colleague, for example, like a nurse, do we still need, can we still not talk in the medical language? Because I suppose one of the reasons I was not very cautious with the jargons was because I was thinking I'm talking to a nurse, who already.
No, you should be talking jargon in any case.
Okay, that's fine. Thank you.
Okay. If no
Yeah.
other questions, we can move to the next station.